Welcome, and thank you all for joining us today for the AHRMM webinar, Transformational Supply Chain Practices for a Value-Based Environment, part one of our four-part series on best practices for operating at the intersection of cost, quality, and outcomes. We'd like to thank Nexera, our CQO sponsor, for their support of today's webinar in AHRMM's Cost, Quality, and Outcomes movement. Hi everyone, I'm Mike Schiller, Senior Director at AHRMM, and I'll be moderating today's session. As a reminder, all lines have been placed in listen-only mode, but you can ask questions by typing them in the Q&A box. The Q&A box can be opened by hovering your mouse at the bottom of the WebEx browser, clicking the ellipsis, the icon with the three dots, and clicking Q&A. The Q&A discussion will be held at the end of today's session. AHRMM launched the Cost, Quality, and Outcomes movement knowing that supply chain leaders are best suited to lead CQO initiatives for their organizations. But many questions remain as to how to apply CQO principles to everyday operations across a healthcare system. Today, we will walk through a roadmap towards operating at the intersection of CQO as supply chain moves into a value-based environment. We are thrilled to welcome today's speaker, Christopher O'Connor, President and CEO of Acurity and Nexera. After today's sessions, you'll be able to identify the steps for progressing your supply program toward operating at the intersection of CQO and explain how to achieve a fully integrated model that aligns value-based purchasing goals organization-wide. Christopher, I'll now turn the presentation over to you.
Thanks, Mike, and thanks everyone for joining our newly formatted, shortened version of WebEx's. I think that the format is going to work for people. So let's jump in. So the current administration, in case anyone has missed this, is pushing very hard, and has been pushing very hard, to both repeal and to replace the Affordable Care Act. And I can't tell you how many times people have asked me, okay, so do we have to continue to worry about value-based care, or is that something that goes away if the Affordable Care Act goes away? And the answer is a resounding no. We do need to continue to plan for value-based care. So although America's healthcare delivery system has been under intense political, let's call it, flux, and even though some of the federal programs have been modified and have undergone slight changes in emphasis, every factor is still showing us that we are continuing to move away from the fee-for-service reimbursement system. And it's probably one of the few areas where there is bipartisan support to continue to move forward towards a value-based, patient-centered care model. And there have been essentially no conversations stating otherwise. So your organization, my organizations, need to continue to have a plan. And as supply chain professionals, you need to know and understand and be part of what that plan is. Because as I've said many times, the supply chain has always followed and likely always will follow reimbursement. So let's jump in. So what is value-based care? It's a transition to reimbursement models that reward quality of care over the number of visits or tests ordered. It is a significant challenge for healthcare professionals, as everyone is aware, to move away from what's they've long been accustomed to, this fee-for-service method, and unaccustomed to the vast data that's needed and cultural changes that are necessary to be successful in this radically different environment. So how does that relate to the supply chain professional? Well, enter AHRMM's CQO movement. CQO defines supply chain's new role in a value-based environment. But to be clear, the CQO movement is not just about the supply chain. It is about improving health care. The IHI's triple aim can be looked at as the impetus for delivery system reform. So just as the triple aim places focus on the larger patient population, CQO also has a broader focus, which is enhancing our contribution to the delivery of better, more affordable patient care. So the CQO movement looks at this intersection and the relationship between sort of all costs, the quality of care to achieving at the best possible health, and financial results that are driven by better patient outcomes. So what does this mean for you? What does it mean for me? So in order to remain relevant, both you and your organizations need to be willing to evolve. The supply chain is inextricably tied to the financial viability of your organization in a value-based environment. And we all must recognize our role and how important role we play today and tomorrow, and how we will need to evolve in order to be part of that evolution. And what is that? So it means your program needs to be highly reliable, predictable, proactive, analytical, and clinically integrated. You and your team, my teams, need to be much more knowledgeable about the new care environment, about products, about clinical efficacy. And you'll need to be even more involved and be even more strategic and collaborative and clinically informed. Taking the supply chain out of its silo to work collaboratively alongside clinicians, physicians, and other service leaders is critical to all of our ability to evolve, to deliver higher value of care for less, and then to operate at this intersection of CQO. AHRMM recently released this rather long but comprehensive definition of the clinically integrated supply chain. So I'm not going to read it, but I do want to hit a few high points. Clinical integration is an interdisciplinary approach to deliver the highest value of patient care. And it's achieved through the coordination of clinical and supply chain knowledge and data. And lastly, leadership is critical to clinical integration and safe, evidence-based, quality patient care. As I have said for a very long time, we as an industry of supply chain professionals need to stop looking to improve the supply chain as if it was a standalone function. Supply chain transformation needs to be holistic. It requires a cultural evolution to a clinically integrated department that's focused on reducing overall operating expenses and improving the overall quality of care. And this requires a clear vision and a robust, both short-term and long-term plan. So how do you do it? At Acurity and Nextera, we like to think of the supply chain transformation from the lens of achieving different, smaller objectives in succession. So the first one is that we need to assess ourselves. So do you place the appropriate focus on internal controls, on continuous process improvement, on staff education in the new world order? These are fundamentals that need to be established before you can take on more strategic objectives. The second is we need to assess our overall operations. And why is that? Because if you cannot perform the fundamental supply chain practices successfully, the progress that you make will continually be challenged. I like to call it the basic blocking and tackling of the supply chain. The foundation of all operations should be an integrated and optimized technology infrastructure and a highly reliable culture. At Acurity and Nextera, we view the supply chain operations as a holistic process. Performance in one area links directly to the performance in the next. As I've laid out on the screen, what we believe to be best practice characteristics for each of the main areas of the supply chain. And this is what we need to be striving for. And what we've tried to do in our latest book that we've sort of gifted to the healthcare community is we've tried to lay out tips for how to achieve this. And finally, we need to create a robust, long-term transformation plan. The truth is, if you've seen one hospital, you've seen one hospital, because every organization is different. And you need to create a plan that takes into account your organization's and your division's culture and current operations. So the image on the screen is the model from our book. And it's the model that's used, hopefully, as both a reference and a starting point. And that transformation plan should include steps for bringing different areas of operations to best practice, as well as creating the infrastructure that better supports a clinically integrated model. So let's take a few minutes and hit on each piece of this plan. So the first is engaging the network, which is engaging the end users, administration, and even suppliers, which is a key step in the supply chain's evolution. In the historic provider-supplier relationship, conversations revolved almost exclusively around price over value. The new conversation needs to address healthcare issues over the supply chain issues. And to do this, you need to understand the needs of your clinicians and physicians and incorporate that feedback into the sourcing process. So how do you engage these individuals? The only way to do it, from my experience, is to speak their language. So keep the focus on quality and patient safety, and then approach them with information, both spend data and quality data and benchmarks. And those benchmarks and that data needs to include both clinically and functionally equivalent product information. Because the truth is, although this is changing, many clinicians and physicians just don't understand the cost impact of their decisions. So we need to educate them while at the same time building the relationship with them. The next is transforming the culture. The relationships that you develop in the previous step really can help support this one. I've not yet seen a supply chain governance structure that is not needed to evolve in order to facilitate the change that's required to support this transformation into the fully clinically integrated model. Implementing a true physician-led value analysis structure has proven time and time again to be the most successful way to formalize and to sustain the cultural change that's needed to make this evolution possible. The other pieces that need to fall into place, such as the use of alternative supply chain data sets, variability, physician use, outcome, and staff education, naturally fall into place through this process. And the next two webinars that we will be doing in the next few weeks in this series will dive more into those exact things. So then lastly, the creation of the integrated model. So by this step, you should have the right multidisciplinary culture in place. You know you've gotten there when your supply chain goals are aligned across your organization with new measures and new data sets that are used to make evidence-based purchasing decisions. Your focus should now be on how products are used and what is the total cost and what's the difference in quality, and then looking at the comparative effectiveness of all of those. It's at this point that you should be able to drive outcomes-based contracts. That's right, outcomes-based contracts and initiatives that share risks and potentially rewards with your suppliers. And the webinar that we're doing on September the 26th is focused on exactly that topic. So how do you align value-based purchasing goals across your organization? Well, it's through a team-based model that includes all stakeholders and subject matter experts who can provide insight into metrics and other factors. In order to evolve and meaningfully contribute to your organization's value-based goals, you need to build and nurture these relationships and create a new governance structure and culture that incorporates a feedback loop into your sourcing decisions. Because supply chain transformation is now all about creating a new mindset as to how you approach procurement, while at the same time improving your quality of care. So our organizations are helping many other organizations undergo this change. The biggest thing that we've seen is that you just don't know what you don't know. If you're living it, you're likely just too close to it. So in order to successfully achieve a clinically integrated supply chain culture, you need to have your other areas already buttoned up from an operational perspective. So how do you know what you need to improve? Where do you start? Everyone needs an objective view as to where they have some performance gaps in order to truly understand their performance. So just a couple of tips in terms of how can you get other people's perspectives. Having a 360 survey, not a bad idea. Survey staff, and survey staff outside of your department. Network with peers. Ask them what they're doing. Work with a third party. Could be a consultant, could be a GPO. Ask your suppliers. We also have provided, and we've tried to gift it to the healthcare community, a free assessment that will help organizations do that self-assessment to see where the gaps are, and then to take it where they'd like. Because evaluation is going to be this first step in creating this effective transformation plan. So, in summary, here's what I want you to take away from this presentation. The first thing is that the supply chain needs to evolve in order to own its new role in the value-based environment. Value-based care is not going away. Second, the supply chain transformation and the CQO movement is not, again, just about the supply chain or about supply chain issues. If we are not focused on improving healthcare through the supply chain, we're working on the wrong things. Thirdly, transformational supply chain practices and clinical integration are one in the same. Our ultimate goal needs to be to create a clinically integrated supply chain. The fourth, these are lofty goals for very many people. So we need to approach this transformation as a series of incremental steps to ensure success and sustainability. Your supply chain operations, again, need to be buttoned up before you take on new but required strategic endeavors that we have already talked about today. And finally, culture eats strategy for breakfast every day. So know and understand your organizational culture and operations so you can create an effective plan for your individual organizations. What works for you may not work for others, and what works for others may not work for you, but you do need to know what others are doing to take best practices back into your organization. So just a quick highlight, there are 3 additional webinars in this series. On September the 12th is capturing and applying alternative supply chain data sets. On the 19th is the creating a clinically integrated supply chain culture. And then on the 26th is on contracting. It's creating an outcomes-based contracting strategy. And I believe when people signed up for this webinar, we had made an offer that anyone that has any interest in receiving a free copy of our latest book that we put out on CQO, you can click on the link, and we're happy to send you out a copy or two, whatever it is that you would like. And with that, I'd like to open it up for questions.
Christopher, thank you for a great presentation. Wow, that was a mountain load of information, valuable information. As Christopher mentioned, we'd like to go ahead and open this up now for some questions. So if you haven't done so already, please type your questions into the Q&A box on the right side of your screen. Okay, we've got a question here. I'm trying to get to it. On slide 7, what does IHI stand for in the gold portion of the slide?
Oh, it's the Institute of Health. They're the organization that coined the triple aim.
Great, thank you, Christopher. So again, just a tremendous amount of information in a very short period of time. I really liked your slide about changes here. It is. It's not coming. It's here already, and the status quo, right? The program initiatives and focus points, the people aspects of it. I love to create your transformation plan. That's a really nice little roadmap. Let's just spend a second here on the transactional and on the foundation here of this pyramid. Assess your current operations. You list a number of transactional operations, transactional points here. What would you recommend for our listeners to be perhaps the first point or the first area that they should focus on? Or is there one area that they should focus on? Should they focus on multiple areas at the same time?
Well, when I referenced that you sort of need to get your house in order before you can take on the more strategic, what I mean by that is in order for the supply chain to be viewed as sort of C-suite eligible, right, to be viewed on the same level as other C-suite organizations, it doesn't mean that in the supply chain, you're going to stop doing sort of the basic blocking and tackling. So it doesn't mean you're going to stop placing orders, and it doesn't mean you're going to stop resolving issues with accounts payable and issues with distribution, et cetera. But you're just not going to. It's just not going to be the strategic focus. But that doesn't mean it's not important, right? So getting your house in order means that all of the, again, basic blocking and tackling of the supply chain, so the transaction functions need to hum. Because if it doesn't, you won't be trusted to move into like a clinically integrated supply chain. And you won't be trusted to work more closely with physicians because they will hearken back to, yes, well, you have stockouts all the time, or gosh, it takes 3 weeks to get an order in, et cetera. So that's really what I reference in terms of assessing your operational capabilities and make sure that that's all locked down really as the first step before you move into a clinically integrated world.
Great, thanks for that, Christopher. Another question here. When vetting, yeah.
Oh, sorry. Go ahead. Sorry.
Go ahead. No, go ahead. Go ahead, Christopher.
Well, one question that I get a lot, and I'll sort of preempt it, is, well, why do you focus so much on when you're creating a value analysis system within your health system or a hospital? Why is the focus so much on physician-led? And what if my organization doesn't want to have a physician-led value analysis? And I will tell you that just from experience, when you don't have a physician champion leading your value analysis efforts, which is very different from participating. They need to actually lead it. It makes all the difference in the world. Truly all the difference in the world, because other physicians will participate if there's a leader that's running value analysis. It also helps the supply chain in terms of continuing to focus on quality of care and quality measures if there's a physician that's leading it versus even a nurse clinician or the supply chain executive. So I push very, very hard when we're implementing these to ensure that it's physician-led. And I'll tell you, in the cases where I've caved and said, okay, we'll try it your way, it's been a disaster. And they just haven't gotten the outcomes that they had hoped to when we started the process.
That's critically important. Great advice. In that line of thinking here, how do you recommend identifying the physician to engage? What steps would you just talk our audience through on getting that physician champion to lead the value analysis committee?
Well, so it depends on your organization, but the first couple of conversations I would have would be with your chief medical officer. Because lots of times it might be the chief medical officer that leads value analysis. But it depends on the organization. But if it's not her, then she will likely have a couple of recommendations for other physicians that are looking to get more involved, that are looking to make, to a degree, either move into administration from a department chair perspective, or it might be a department chair, or it might be a younger physician that looks to do more within administration. So I've always found that we start with the chief medical officer and get her perspective on where we should go.
Excellent advice. Thank you for that. Got another question here. When vetting suppliers, is there an entity out there which rates suppliers from a CQO perspective?
Interesting. Not one that I know of. Not one that I know of. And I will say that it's interesting with suppliers and sort of going at risk from a CQO perspective. Because on the one hand, the suppliers have been talking quality much longer than we have on the supply chain side, right? They've always, and that's sort of how they've, to a degree, and I say this in quotes, gone around us to talk to physicians. Because physicians want to talk about quality, and suppliers have historically also wanted to talk about quality, and historically we wanted to talk about price. So, so on the one hand, suppliers are ahead of us, just from the vernacular of quality and clinical efficacy of their supplies. But on the other hand, when you then start to talk to them from a contracting standpoint, there's a lot of work to be done, because in order to truly figure out, okay, how can we go at risk together, right? There are a lot of moving parts, and there are moving parts that you don't control, and there are a lot of moving parts that the supplier doesn't control. So that's where you need to pull in the different clinicians, as well as finance, to come up with a plan to move the entire organization to better quality of care with that supplier. And sometimes it's multiple suppliers that need to be pulled into the contract to make it happen. And I would say that some suppliers are obviously more open to this than others. And you just need to start to have the conversation.
Well, again, great information, Christopher. Thank you for all of that detail and the information you just shared. We are at the bottom of the hour. We're at 12:30 here, and we are at the end of this webinar session. So if there are any questions that went unanswered, we're going to keep the WebEx session open here for about another 5 minutes or so at the conclusion of this webinar for you to go ahead and type your questions in. We'll make sure copies of those questions get to Christopher and his team for a response, and we'll share those responses with you. I want to thank everybody for participating in today's webinar. We look forward to seeing you on September 12th for the webinar on capturing and applying alternative supply chain data sets. And as a reminder, after the session, please complete the presentation evaluation so AHRMM can improve our education for you and other healthcare supply chain professionals. You will receive your continuing education certificate about 2 weeks after you complete the survey. Once again, thank you for your time. Christopher, thank you again for a fabulous presentation and great information. Have a great day, everyone. Bye now.